All right. So have you ever like gotten sick and you just
can't quite figure out what's going on?
Exactly. Like you just don't feel right.
Ugh, the worst.
That's actually what we're going to dive into today.
Yeah.
You guys sent us this fascinating medical case study. And
I love these.
Yeah, me too. Me too. I love these.
Yeah.
So this one's fictional, but it really does.
It gets you thinking.
Yeah, it really gets you thinking.
Yeah.
All about a college student. Her name is Barbara, and she gets hit with this super stubborn illness.
Yeah. It's like a real classic, what's the diagnosis scenario? You know, we've got like the symptoms, the tests, the treatment. It's almost like a real life episode of House.
Yes.
But instead of like a cranky doctor, we've got
we got microbiology.
Microbiology on our side.
Exactly.
Yeah.
So let's set the scene. It's January. Barbara's back at college after winter break, living that dorm life.
Oh, yeah.
And suddenly, bam, sore throat, headache, fever, chills.
Oh, the works.
The works.
Yeah.
And then comes this cough,
Mm-hmm.
this persistent cough that just won't quit.
Ugh.
She tries all the usual over-the-counter remedies, but nothing seems to touch it.
Right.
So a week drags by, and while some of the initial symptoms like ease up a bit, that cough and the fever are hanging on for dear life.
Oh, no.
And she's completely drained. Like, I can practically hear the exhaustion in these case notes.
I mean, just reading through them, I was tired.
I know, right? Yeah, for sure.
Yeah.
So that's kind of where things get interesting, right?
Yeah, right.
Like those early symptoms, especially that lingering fever and cough. Those are kind of like...
Those are like the big clues.
Yeah, they're the crucial clues.
Right.
So a sore throat might suggest like a run-of-the-mill cold.
Yeah, you know, you just kind of brush it off.
But the fever and chills, that's your body kind of signaling, hey.
Like something else is going on here.
Yeah, like pay attention.
This is serious.
Yeah, exactly. Like these are the red flags that make you realize, okay, this isn't just a sniffle.
Right.
So Barbara finally hauls herself to the student health center.
Right.
You know, after a week of this.
Start move.
So she gets there and the physician assistant, you know, the PA, starts piecing together the puzzle.
Right.
They're considering everything from the flu to bronchitis, even pneumonia, and just to be safe, tuberculosis.
The works.
The works.
Yeah.
You know, just in case.
Right. You got to rule everything out.
Yeah, you got to rule everything out.
Yeah.
So, and the PA's examination, though, uncovers these really important details.
Right.
So, for instance, they noticed that Barbara has hypoxemia.
Oh, interesting.
And now, I know that's a mouthful, but...
A big word.
It's a big word.
But for anyone who's not familiar, hypoxemia basically just means that the oxygen level in her blood was lower than it should be.
Interesting.
Yeah.
Okay, so that's not good.
That's a no-no.
So they also heard this like crackling sound in her lungs when she breathed.
Right.
Which doctors, I guess, call rales.
Yes.
And saw she was coughing up this greenish mucus.
Mm.
So all of these are, I guess, telltale signs pointing toward pneumonia.
Yeah. It's looking like pneumonia is the main suspect.
Okay, so pneumonia's on the scene.
Yeah.
So to confirm this, they do a chest x-ray, which shows a shadow in Barbara's left lung. Classic pneumonia.
Right.
But, and here's where the real mystery kicks in.
Ooh, I love this part.
Right.
Yeah.
The usual first line antibiotic, amoxicillin, doesn't work.
Oh, that's not good.
It's like hitting a brick wall in her treatment.
So, and this is where, you know, like understanding a little bit of microbiology can really help us crack the case.
Right.
You see, amoxicillin works by attacking something called peptidoglycan, which is a key component of most bacterial cell walls.
Okay.
So if it's not effective,
Right.
that tells us the culprit might not have a typical cell wall.
Oh, interesting.
So could it be a virus, maybe a fungus, or perhaps a bacteria with a different structure altogether?
The suspense is killing me. I know. Right. I got this poor college student battling this mysterious illness, and the usual weapon in our arsenal is useless. What happens next?
Well, the PA makes a really insightful call.
Okay.
They prescribe azithromycin, which works differently than amoxicillin.
Okay.
It targets bacterial ribosome, which are essential for protein synthesis, rather than the cell wall.
It's interesting.
And thankfully, Barbara starts to feel better. It's like the antibiotic finally found its target.
Oh, thank goodness.
Yeah.
Okay, so a happy ending for Barbara.
Yes.
But I've got to know, what was the culprit behind all of this?
Yeah.
What kind of bug can just like shrug off amoxicillin like it's nothing?
Yeah, it's pretty impressive.
Right.
So given all the evidence, the symptoms, amoxicillin's ineffectiveness, and then azithromycin's success, the most likely answer is Mycoplasma pneumonia.
Mycoplasma pneumonia.
Yeah.
That's a mouthful.
It is a mouthful, but it's a type of bacteria.
Okay.
But here's the twist. It lacks a cell wall. So that explains why amoxicillin, which targets cell walls, was a total flop.
Oh, that makes sense.
Yeah.
So it's like this stealthy bacteria.
Yeah,
sneaking past our defenses. This whole case really makes you think, right? Like we often just like pop a pill
right.
and expect to be like magically cured.
Yeah, like a quick fix.
But this really highlights how crucial it is to like understand what's actually causing an illness.
Yeah, for sure.
And how different treatments actually work.
It's like having the right tool for the job, right?
Yes, totally.
Yeah.
Like you wouldn't use a hammer to, saw a piece of wood.
Exactly.
So in Barbara's case, while fictional, does bring up like a much larger point.
Oh, absolutely.
We're seeing this rise in antibiotic resistance worldwide.
It's a huge problem.
And it's kind of scary because like it means more and more bacteria are becoming immune to the drugs we use to fight them.
It's like they're outsmarting us.
Yeah. So that's why it's so important to only use antibiotics when absolutely necessary and to like finish the whole course as prescribed.
Right. Like don't stop taking them.
Yeah. Even if you start feeling better.
Yeah, exactly.
Because we really don't want to create more of these like superbugs like this.
Like Mycoplasma pneumonia, right?
Yeah, Mycoplasma pneumonia.
That can just kind of outsmart our medications.
Exactly. That's a really sobering thought.
Yeah, it is.
So next time you're feeling under the weather.
Yes.
Remember Barbara's story.
Right.
It's a good reminder that even what seems like a simple illness can have this really fascinating and complex story unfolding at the microscopic level.
It really is, yeah.
And it's a reminder that understanding that story can be really crucial to getting the right treatment and protecting ourselves in the long run.
Couldn't have said it better myself.
So stay healthy out there, everybody.
And be mindful of those antibiotics.
You got it.
Yeah.
All right, that's it for our deep dive today. Until next time.
Bye.